how do we drive change in a system this large? Well, it takes time. It's not for the faint of heart. And it takes environments where we can innovate and demonstrate and learn from successes and from failures about what's working before we deploy that across the system. And so many of you are doing phenomenal innovations every day at the bedside. So how do we capture that and learn from that? We need to take the voice of the veteran and have them partner with us in every step of the way. We need to learn from both basic and system research, and then use that to form these pilots that are ongoing. As we learn and grow from those, we'll create the education that we need to help spread this across the country. But that is an iterative process. It goes around and around. It's not that we have the answer, here it is, plug and play. It's a process and it'll take years. So what does this look like? What does this approach to healthcare actually look like? Well, it's interesting to think about the elements of patient-centered care, which is part of what we're talking about. There's two primary domains. One is about the experience of healthcare. What does it feel like to enter into, let's just say, for example, a hospital? I'm guessing you've had the experience, because I certainly have had, where I walk into an environment, sometimes it's a clinic, sometimes it's a hospital, and every part of me is telling me to get out of there. I don't like the smell, I don't like the sound, I don't like the sights. It's not a healing environment. So what does it look like? And many VAs around the country have done amazing work in this area to create an environment where you feel safe, first of all, and it's a healing space. It's a healing environment. You can feel your shoulders drop. You feel at ease. You know you're going to be well taken care of there. Those environments are critically important and actually affect everything, including immune function. And what about healing relationships? What does that mean? That means that every human interaction, whether it's at the front door or with the surgeon in the OR, has an impact not only on your experience but also on your outcomes. We all have had experiences where a physician or someone in a white coat could say something that actually brings fear or even inadvertently causes harm. And I'll give you a quick illustration of this. As you know, probably I'm an OBGYN, and I had a patient that had a very high-risk pregnancy and needed a C-section to deliver the baby. We knew this in advance, so it wasn't an emergency. She did a lot of preparation for the surgery and felt very ready to have the surgery. She was relaxed. We were in the holding room, which is the space before you go into the operating room. She'd done some mind-body approaches and some imagery with me, and she felt very comfortable and ready and at peace, really. The anesthesiologist walked into the room, who I had not met, she had not met. And it was interesting because you could tell he was uncomfortable with the degree of relaxation in the space. Like he wasn't used to it. It was odd. He thought something was wrong. He didn't, unconsciously. He walked over to her bedside and he looked at her and he said, "I need you to understand something. This is a very high-risk procedure." And I just saw the color wash out of her face. Her fear returned. And I understood that what we had done to prepare her was in that moment reversed. Now, he didn't mean to do harm, but these are the ways in which our communications can actually do harm when the opposite is what we want. So that whole side of the equation, the experience side of patient care, we should be doing each and every day to the best of our ability now. Currently, we're also looking at what are the core competencies or the behaviors that all of us need to work on in order to deliver this kind of care. And right now, we're talking about healing communication. How do we use the power of our interactions and our words to support health and healing for the veteran? What about partnerships? How do we form the best partnerships? And that means both with the veteran, it means with each other's on our teams, it means across teams, and it means up and down the organization. How do we have the freedom to say what we mean and take action when it's in the best interest of our patients? Personal mastery. Part of personal mastery is being self-aware and being willing to reflect on our own behavior, our own experience, and change that and adapt that as we move forward. And the fourth core behavior that we've identified is one word: change. We have to have the willingness to take some risk, to change and do things differently and not punish that, but reward that. Sometimes it's going to turn out well, but not always. We need to learn from our errors and incorporate that and adapt as we move forward. The result of these core behaviors is meaningful experience and outcomes. And I love that language, meaningful. It's meaningful to the veteran. It's meaningful to the employee. Meaningful experience and outcomes. Those are the core behaviors that we've identified to help get us where we need to go. What about the practice side? The practice side involves what happens when you actually enter the system for healthcare. And there are two elements of that we're going to talk a little bit more about. They're significantly different from our current system. They integrate and build on what we currently do, but they're expanded. One is the personalized health approach. What is actually the process that you go through if you're here in a way that we want to do personalized, proactive, patient-driven healthcare? It's a different process. And what are the areas of your health that we're going to look at? If we're going to be proactive about your health, we're going to be looking at some other areas that maybe traditionally your physician hasn't looked at with you. What's involved in a personalized approach? Well, it starts from a different place. It starts with a personal health mission, helping the veteran explore what that means, what matters to them, and creating a plan around that. It's interesting if you think about planning and health, they don't usually go hand in hand. I like to remind each of us, that we plan for most things that matter in our life. We actually plan for our death. Think about it. We plan for whether we want to be buried or cremated, what's going to happen to our things, if we have young children, what's going to happen to them. And we often have given more thought and planning to the death than to our health. So what's up with that, It is part of the reason we have this reactive approach. So one of the key components is starting with your own personal health mission and creating a plan. We also know if we're going to be proactive, we need new strategies in addition to the pharmaceuticals and the surgeries. There are nutritional strategies, mind-body strategies, relationship strategies that can all impact our health. So it's a more comprehensive, proactive use of strategies. But even if we have a great mission and plan with comprehensive strategies, we will most likely not succeed unless we give people the skill building they need to implement the plan and the support across time to do that. Those are elements that currently are not emphasized in our healthcare system. So bringing that all together, personalized health mission and plan, whole person proactive strategies, and skill building and support that works. One thing that is absolutely clear, you could have a wonderful personalized plan for your optimizing your health, and it could involve strategies and approaches that are proactive. But if you don't have both the training and skills that you're going to need to succeed in that and the ongoing support, not much will change. So that is really critical.
Come on in.
One of the things that's different is we start with asking the veteran to reflect on some things that they may not usually think about. What really matters to them? And while that might sound hoity-toity, I have news for you. If you are a homeless veteran and what really matters to you is having food and shelter, there is no more significant and higher purpose than that. So this works wherever you are, whatever your conditions in life. What really matters to you? What do you want your health for? And these are not things that we walk around thinking about. These are not superficial questions. But digging deep about really, what do you want your health for? What brings you a sense of joy in your life? And what brings you a sense of sorrow? Can we dial up the joy, Being aware of your senses of sorrow and your places of sorrow or pain is important in this approach to healthcare. We ask people to reflect on how they feel physically in their bodies from a -5, miserable, to a +5, great. And this came about because we were reflecting on the fact that, we take pain scores. We're very good at looking at the negative side of the scales, like how much pain are you in or how depressed are you. But we don't ask, do you feel good in your body? Or are you happy? It's interesting, right? It's another illustration of our paradigm of healthcare, our model of healthcare that's about the disease side. But if we're striving for optimizing health and well-being, we better pay attention to where are you on the plus side and how far on the plus side are you? So we ask people to reflect on their physical state of being right now, how are you feeling? -5 could mean you're in pain, you're exhausted, whatever that means for you. +5, you feel great. And the same on the mental emotional side, where -5 could be anxious or depressed or sad, whatever that is for the person, and a +5 really feeling vital and awesome and alive and connected. So beginning with this reflection of where you are and how you're feeling, if you're going to drive your healthcare, it has to start with you. So when we talk about proactive components of healthcare, what do we mean? This graphic is going to help us to understand that. The first thing you'll notice is that you, the person, is at the center. As we've talked, if it doesn't start with what matters to the person, the rest really doesn't matter. It doesn't matter how great of a plan we have. So exploring that, and I just want to say that we often don't know in depth what really matters to us. It takes some exploration. That's the starting place. Then notice what's around that, mindful awareness. Well, what does that mean and what does that have to do with this? This concept is pretty simple. It's about paying attention. But it is about paying attention to our current state of our mind, of our body. Why? Because we cannot be proactive and act in advance of something if we're not aware, if we're not hearing the whispers of our body, our soul, the small signs, the small symptoms. We don't have a chance of reacting until those symptoms are screaming. And then you're far down on the right side of that curve. So teaching the concept of how do you pay attention and listen to the signs and symptoms, be aware and mindful, is a critical piece, and it applies to every aspect of this wheel of health. The area in the green is self-care, and we may give professional opinion or consults or help in these areas. But fundamentally, it comes down to what an individual does in their life, in their day-to-day world. And you'll see these areas combine all sorts of aspects that affect our health. The conventional ones you would think of, fitness and how do you move your body, what do we eat and drink, but some areas that you may not have thought about, such as your relationships, your spiritual life. How do these things impact your health, and are there areas you would like to do to bring you to a different level of health? The outside ring of that is professional care. It's what we typically think of as medical care. So everything from interventions to prevention, everything from complementary therapies to conventional therapies. What does professional medicine bring to bear on your future health? And the last piece, and in some ways the most important, the community in which you live and work, and how can that further fuel and support your health and well-being? And what's interesting about this, and what's amazing about it being a part of the VA, is that we have resources in areas that mainstream private sector healthcare doesn't actually even have resources. So we are in such a great position to offer this approach to our veterans and to model it for the country. Just a few examples. This is a dynamic kind of scheme, and you can add your own elements to the environment you're in. But just a couple of examples. Working the body. We have MOVE, that weight management program that NCP has developed. We have Telemove. We have places doing shark attacks where they come in and they help people at their desks move and do different things. Programs like Tai Chi. We have the entire rehab programs. We could go on and on. We have so many resources that are available in the VA and in the community around working the body. What do we mean by surroundings? Well, that means, are you in an environment that, first of all, is safe? And if not, what can we do about that? And furthermore, is it an environment, both physical and emotional, that allows you to be healthy and well? Think of the programs and offerings we have. Everything from housing and urban development with VA subsidized housing, to things like Creative Arts Festival, home-based primary care, where you can have your primary care in your house, you can have your hospital care in your house, VA home loans, coordinated telehealth, the domiciliary programs, the sexual trauma counseling, the caregiver support program. The list goes on and on. We have so many offerings, but how can we help address the person's surrounding that clearly affects their health, their well-being? Personal development, both from a work side and a personal side. What about vocational rehab, the GI Bill, compensated work therapy, voluntary services, Veterans Health Library, mobile applications, the vet centers, veteran service organizations? Again, the list goes on and on. In the area of food and drink, what does it mean to have a healthy relationship, both with food and with drink? We have the MOVE weight management program. We have nutrition classes, things like farmers markets, the demonstration kitchens and the nutrition and food services, the diabetes education classes, inpatient menu ordering. We have tremendous offerings here. Recharge is an interesting area. It's an area I was never actually taught to ask patients about. Not just do they get enough sleep, but what's the quality of their sleep? Do they actually feel invigorated and ready to start their day in the morning, or do they wake up feeling exhausted? And how can we improve the way we rest and recharge? Well, there are programs in the hospital around noise reduction. There are sleep clinics. There are tools like progressive muscle relaxation and sleep hygiene. Lots of different approaches that can help in these areas. How about the whole area of friends, families, and coworkers? You know, it's an interesting, again, another area where I was not conventionally trained to ask about. And yet, let me give you an interesting statistic. If you are isolated emotionally, so you may have a lot of people around you, but you don't feel like you have someone or people that you can say anything to, that you can really connect with, so you're isolated in that way, you have a fourfold risk, 400% increased risk of premature death at every age, whether you're a teenager or an 80-year-old person. And let me tell you, a 400% increased risk is a bigger risk factor than all the things I was trained to ask about as a physician. That's huge, and yet we don't typically address that. Well, now we're going to, because that's something people can do something about. And we have tremendous resources to help. The vet center, counseling, warrior to soulmate programs, marriage and family therapy, peer support programs, resident and family councils, the VSOs, things like pet therapy. Pets are phenomenal at connecting with people's hearts and breaking down that isolation. Shared medical appointments where you're in a group therapy, the list go on and on. Spirit and soul. This, for many people, relates to their religious practice or beliefs, but for many people has nothing to do with organized religion. It's where do they feel connected to things larger than themselves. So these are the areas. For some people, it's nature or art. We have tremendous resources: chaplaincy service, living history program, drum circles, sweat lodges, the walls of heroes, narrative medicine, storytelling, walking labyrinths. These are just a few resources that can help people address these areas in their life and their health. Power of the mind, one of my favorite topics, and the reason it's one of my favorite topics is I think it's one of the most underutilized aspects of what can affect our health, our healing, our disease. Just to give you an illustration of the power of the mind, there are many documented cases now of people undergoing invasive surgeries with no drugs, no anesthesia, nothing, just medical hypnosis. And I use that as an example because that's a pretty powerful thing. I mean, C-sections, major surgeries. And if the mind has the power to block that kind of invasive procedure and do the whole thing without anesthesia, the mind is incredibly powerful. I don't think we've begun to understand all of the opportunities to use the mind proactively. It's an incredibly important part of being proactive about your health. On the negative side, stress reduces your immune system, even affects your gene expression, and the actual things that hold telomeres, which actually are incredibly important in our aging process, all affected by stress. So we can use mind-body approaches to reduce our stress. We can also use mind-body approaches to proactively optimize our health. And we have a tremendous number of tools in this area: stress management programs, guided imagery tools, healing touch, EMDR, medical hypnosis, mindfulness-based stress reduction, biofeedback, meditation, yoga, the list goes on and on. Now, are all of these things immediately and readily available today for every veteran across the system? No, not yet. But what I do want us to understand is we have so much more in place to build on and grow than any other health system in the country that we and our veterans are very, very fortunate. The wheel outside of the self-care area is our professional care. So that includes everything that we would do for prevention and early detection and screening, all the way through intervention. It draws on the best of conventional medicine and complementary therapies. And beyond that is our community. We live in communities. And what and how can we draw on that to optimize our health and well-being? So the way this all comes together is you, the person, plus your self-care, plus your professional care, plus the community creates your proactive whole health care.